problem with that, please let us know. We're recording now. So I hope you have no problem with that. We would like to ask the participants online to just say hello in the chat so we know who's there. And also, please feel free to ask any questions, to make any comments you have online in the chat, and we will check the chat and bring in your comments as we go along. We will start with a brief presentation. We will then have time for question answer, and then we go into a discussion with two very distinguished guests here on a chat panel. It's not a panel, it's a discussion. And then we would also like to involve you all a little bit in starting to think about what a revision process could actually look like and what it might entail in terms of content. And I would like to stop there, unless there's any problems, any questions right now. And I would hand over to Philip to start the presentation. Thank you.
Okay, so we're going to do 5 Mentimeters, 4 Kahoots.
Oh.
It's nice to see everyone in person, and very nice to see. We have about 40 people already online and in chat. So if you can just keep adding them on. What I would like to ask though is just, I see a lot of familiar faces. Nice to see you all again. A lot of people joining us online. Could you let me know, first of all, how familiar you are with the core humanitarian standards? So if you're somewhat familiar, maybe raise 1 finger. If you're a little bit more familiar with it, 2, 3, 4, and 5 if you're a complete expert on the CHS, on the core humanitarian standard. Go ahead, raise your hands. Got some 3s, 4s.
Watching. I'll do a 4.
There's a suspicious person in the back who says he knows nothing. And let me just see what our participants online have said. This is a strange thing to be doing as a hybrid, isn't it? Let me just share the full results. We'll try to see what the full result says, but there's a lot of you with some experience, some with some expert experience, and some perhaps getting for the first time familiar with the core humanitarian standard. And that's great because it's a standard, I think, that's applicable to all of us, but many of us have more familiarity, others have less, and it's a really opportunity with this revision process to come together and share experiences and learn from each other about what the future commitments to affected people might look like. So let me start with a picture of a screw. What does a screw have to do with accountability standards? It doesn't seem like a lot at first, but in fact, there's a line of progression and a history between manufacturing screws and the core humanitarian standard. So we're going to look at how we got from the screws to the standard, and how, more importantly, what comes next and what the future of this standard might look like. So let's start back with the story of the screw. In 1947, the International Standards Organization had its very, very first standard on manufacturing threaded screws. And it was an attempt to answer the question, what's the best way to manufacture screws so that they work the way they should, that they're consistently reliable, and manufacturers follow a certain set of standards so that the users of screws will also have some confidence in what the screw is going to do, what its intended purpose is. Now, CHS went through some similar process of consulting with experts and deciding what's the best way to do things, but the questions are quite different. rather than a physical manufacturing object, it's really about the relationship between aid workers and aid organizations and the people and communities that we attempt to serve and assist. And the questions were, what's the best way to protect people's rights in times of crisis or vulnerability? How do we deliver more effective results for them? And how can we be accountable to them? Now, these questions weren't new. There's a long tradition of asking these questions over and over again in the humanitarian sector. And if you talk about the CHS as a flower, some of the seeds in that garden that led to the CHS start with things like the Geneva Conventions and international humanitarian law. We come then to humanitarian principles. It grows into trees with things like the Code of Conduct and some of our first humanitarian standards, and then leading us to the core humanitarian standard. So there's a long tradition behind the CHS. And I think it's one that we want to really acknowledge and draw on when we're talking about revising the standard. Those three very important standards emerged out of this history. We have People and AIDS Code of Conduct, Code of Good Practice, mainly around people management. The Sphere standard, which came out of trying to determine what the minimum standards required in certain areas of interventions. And of course, the HAP, Humanitarian Accountability Project, accountability standards as well. Each of these had a huge impact on the sector in the way we think about quality and accountability. But we had technical issues earlier with the computer, so I'm hoping that we can advance this. So despite all that, despite all of these efforts about improving quality, effectiveness, and accountability, as a sector, aid efforts didn't always meet people's needs or protect their rights, dignity. And in fact, from some of these many evaluations and reports, Ed is laughing. Yes, there's a few of them there that might look familiar. Sometimes aid efforts actually made the situation worse. And in 2012, kind of began a real discussion again about going back to those questions. How do we do things better? How do we make things better? And part of that was, how do we become more accountable? Is it time for a unifying standard to bring some harmonization and bring us all together? And could a standard like this actually be a way for people to hold us to account? That became the seeds for a very intensive and wide consultation process involving many, many people. And like the standards to develop a threaded screw, a lot of expertise and knowledge and learning went into the reflections that led to what became a common accountability standard. One thing that's really important to remember about the core humanitarian standard, different than, say, a manufactured screw, is that it's actually grounded, rooted in the experiences of people affected by crisis and in what they need and want and expect from us as aid organizations. And that's an important distinction from other standards, maybe in the manufacturing sector or even the service sector. It's really grounded in what people want and expect from us and in those experiences. So the outcome was the famous CHS flower. It grew into the core humanitarian standard on quality and accountability. And it's really grounded again in some very core ideas around accountability. First, what people and communities, what their rights are, what they can expect from us as aid organizations. But second, also about our responsibilities as organizations. How are we also accountable to them? And it does this in an integrated way, starting with based and grounded in humanitarian principles, communities and people at the center, the 9 commitments that you see here in the petals of the flower, along with quality criteria, key actions, and organizational responsibilities. So it's a really comprehensive and integrated standard that is intended to cover many different aspects in a coherent way for us to be more accountable, to be more effective, and to do that in a more consistent and reliable manner. I didn't mention it, but if we're going to use the gardening flower analogy, there's 3 gardeners who are responsible to keep it healthy, but it's a standard that belongs to all of us. And we have CHS Alliance, Group ORD, and Sphere, and I would just moment to ask if the executive director from Sphere and CHS Alliance and maybe from Group ORD could just raise your hands for a moment so we can see you there. We'll come back to you later on in the presentation, but it's really working on behalf of all of us to keep the standard healthy and well. Since 2014, the standard's been embraced by hundreds of organizations, and it's quite remarkable, having been involved in the process to develop the standard, to see how much influence it has in the sector. It's grown and flourished, and I think now 7 years later, it's clearly having an impact in shifting the way we work. First and foremost, it's now the foundation for most all of the technical standards that we use and apply in our work. It is important grounding it again in people and communities, what they want and expect and can hold us to account to. It's become a framework for monitoring and continuous improvement. Many organizations are using this on a consistent, regular basis to monitor, to assess, to verify how they're applying the standard. We can see now the CHS is referenced in many of the policy commitments at the sectoral level. It's also behind many of the other quality and accountability initiatives in the sector. But perhaps more importantly, it's transforming the relationships between people and communities and the organizations that are there to support them. Before the standard, it was hard to think about how feedback and complaints mechanisms, as one example, or asking people about their opinions on the quality, the effectiveness, and the relationship with aid communities. And now, on a yearly basis, thousands and thousands of communities are being consistently asked about these questions. So it's a really interesting demonstration that it's changing and transforming our relationships and the way we think about the relationships with communities and people that are affected by crisis. So there's some strong evidence that it's had an important and positive impact in the aid sector. But times are changing, and it's clear too that as not just us as aid workers or aid organizations, but communities are facing many different crises and situations of vulnerability. We talk a lot about the climate emergency. It's not new, of course, but it's becoming more and more clear that it's affecting millions and millions of people in different ways with vulnerability and situations of crisis. The COVID-19 pandemic is a good reminder of how ill-prepared we all are for future type of outbreaks, whether it's a health emergency or others like that. But also, we could also see a huge amount of distrust or mistrust and sometimes miscommunication that's really affecting at times the relationship that we have as aid organizations and aid workers and the communities that we're working with. Also, some important things to remind ourselves is that there's a growing awareness around the need for being around participation, about inclusion, and also taking a look at or rethinking the imbalanced or unequal power relationships that are in a way structurally embedded in our way of working, and money might argue also in our consciousness, our way of thinking and conceiving the way we work. So we talk about the CHS sometimes being an umbrella standard. We actually need to also make sure that the CHS itself continues to be a strong reference for quality and accountability. And that's why the CHS Alliance, Sphere, and Group ORD have been launching today the CHS revision process. It's an opportunity for us to reflect on what we've learned, what's worked well, and where we need to go. So it's time for us to take a look again at the standard and reflect on, and then decide what works well, what needs changing, and how to maximize its impact. As I said, it's fairly clear, there's a growing evidence that it has made a lot of influence on the way the sector is working and on individual organizations, absolutely. But it's good to reflect on that and see how do we continue to maximize its impact. Because if more people and more organizations know and apply the standard, we can take this flower that we're all, some of us, quite familiar with, and grow it into a tree. A strong tree that might be converted into a forest that helps affected people consistently get better quality, more reliable, more effective, and accountable aid. And that's where you come in. And for those of you online as well, this is an opportunity for us to hear and to learn from those of you who are familiar with the standard, who are using the standard, but also to reflect from others who are maybe not as familiar with it and who can provide insights about their ideas about how to make all of us work in more effective and accountable ways. I'll turn it over to Aninia, who will talk a little bit about the process, and then we'll go into some more discussion about what that looks like.
Yes, so we are opening up a global discussion around the core humanitarian standard. And such a discussion needs to be open and global, but there also have to be some ways in which we can make sense of the feedback and of the discussions that we receive and that we hold. And there are a few elements that we suggest can guide our thinking and the way we enter into discussion. The first one is, we're not just gonna throw everything up in the open, but we would like to reaffirm the core commitments that we have already made in the CHS. We want to work towards simplifying the content without making it simplistic, but simplify, streamline the content. Very importantly, maintain what works, not throw out the baby, the bathwater, and really understand what is it that works and that we want to keep in the CHS. And strengthen what may not be strong enough at the moment, or what may not have been solidly enough understood by the sector at the time when the CHS was first developed. And number 5.5 is the same, update with elements that have been becoming more evident that we really need to address in the CHS. And we think that with this in mind, we will be able to hold discussions that are meaningful and that will help us drive towards an updated core humanitarian standard. And what would that look like? We would hope that the updated CHS would be more accessible, inclusive in the way it is presented, but also in the way it is being used, relevant for today's and future challenges, better known and used. So the revision process is not just there to understand what how people use the CHS, but also to reach out to constituencies, to stakeholders that may not be working with the CHS as much as we think they might want to at the moment, and so broaden the constituency, the users of the CHS. Driving continuous and measurable improvements, really make sure the CHS can help organizations do better work over time, and increase accountability at all levels, starting most fundamentally with the people we serve. so tight. So if everybody could just turn off their microphones online. Okay. Well, this is actually a very important slide because it's a global process, it's a global standard rooted in local realities and based on experiences from people affected by crises and from local organizations, community-based grassroots organizations working with people affected. And that is easy said, very easy, not so easy to do. I've been in revision processes before, I know what I'm talking about. So we are starting a new revision process and we this time are gonna get it really right. We want to really reach out to people affected by crises, to grassroots organizations, and all the way up to the UN, to international organizations, and have that whole spectrum, but rooted in local realities. What you see here is a wish list. We're not there yet, but we'll soon have all those nice little dots where we will be holding revision consultations. There are different ways to do consultations. We will get to that, but the online, the in-person consultations with people will go from focus group discussions with affected people to discussions at organizational level, maybe regionally, maybe within at country level, and then regionally within within a sub-region, a continent, and also global discussions. We will need to count on all of you for this. We are two little people here. We are not going to be able to run the show. We can only manage it and make sure that we cover that the consultations are really global and cover all the constituents and stakeholders we would like to reach out to. But we need you to help us. We need you to reach out to your people, to your networks, and make sure that those revision consultations are happening. Thank you in advance. And this is a just visually a way to understand what the different kinds of inputs, kinds of consultations are that we currently suggest. The first one is the individual inputs. Each of you can go, as of today, or maybe let's say tomorrow, can go online, look at the CHS, the text, the booklet without guidance notes, and provide your input. Say what works, what doesn't, where's the overlap, where would you like to make changes? Suggest those. That is you, community representatives, aid workers, experts, anyone. That's the online outreach that we make. Then at the green level, the organizational input within your organizations, hold discussions with your experts in your organizations. Country consultations, again, at different levels in country. We hope to have quite a few of those. And then regional events and online webinars. Those are important to bring a broader constituency together. That can be online or in person. This is a website that already exists, has been for a while. This will be the place where you will find all the information on the revision. So if you go there right now, you might be slightly disappointed. We've had a little bit of a setback with setting up the page, but it is there, and it will be eventually in English, French, Spanish, Arabic, because the outreach needs to be global. It will have an events calendar where you can find if an event happens around you somewhere. Very importantly, if you would like, whatever you would like to organize, please let us know so we can put it on that calendar, and so that everybody who would like to get involved can find an event that might be around them. The online version of the CHS, where you can provide your comments, is on there as well, the link, and then other resources as we go along, and results and news and everything. So that will be your go-to. This is a very sinewy timeline. It suggests also that we may have all the best intentions and then life happens and things change and don't go the way we plan. So far, we're on track. We had a preparation phase. We're now in the, from May to August, so now we're here. We are starting to gather input, starting today. And in the second half of the year, I'm just going to go through this quite quickly. We will look at what we have received and start to make sense of it, among others, with a range of regional workshops where we can really discuss what have we heard so far, what might that mean for a future for humanitarian standard. Early next year, we hope to be able to draft a first draft, which then goes out to global consultation again in March and April of next year. We will then check that again, bring all the feedback together, refine and review and validate, and the rest of 2023 will be to prepare the updated version, which we hope to launch before the end of the year. How can you get involved, it says? Yeah. Collect inputs from your communities, collect inputs, provide feedback, go online, provide your own personal feedback from your experiences, participate in surveys and so forth that we will put out there on certain specific questions, organize, host, participate in webinars and workshops, share and disseminate the process in your networks, make sure everybody knows about the process and knows how to engage. Provide funding and other resources. Okay, funding, that is very specific. Other resources means help us organize events. That is a resource, that is an in-kind contribution to make the revision meaningful, and then any other ideas you may have. Oops. Back. Okay. So far, this is our presentation. If there are any questions around understanding, I would take them now. Otherwise, we have ample time for discussion later. Anything that wasn't clear that you would really like to? We were clear. Oh.
Are there any decisions that you've already made in terms of changes that you say these are going to happen, or this is something that's going to change that would be helpful for us to know about?
We haven't. That we can't. That's what the revision process is there for. We have ideas, but it would not be right to start predetermining anything. No, we haven't. Short answer, clear answer, no.
Good.
Yeah.
Yeah, good morning. Very good presentation. Just one question. What is the decision-making mechanism that is envisaged with all this process? Who will make a decision? The CHS the version 2 is ready to be published.
Right. Thank you. That brings me to the whole governance structure of this process. So we are to the managers, we report to the management group. The management group consists of the 3 copyright holders, Sphere, Groupe URD, and CHS Alliance. And they are supported by a steering committee, which currently consists of 12 individuals. Some of them are in the room. And the steering committee oversees the process. So whatever, and in the end, it is the management group that will take decisions supported by the steering committee. Now, may I introduce and welcome our two guests. And we had it all lined up, but in the end, you sit wherever you like. All right, very good. Oh. That would be this one. Yes. All right.
So you saw on the screen, we have with us Rahima and Aisha. And we thought rather than us talking about this as facilitators of the process, it's actually good to listen to representatives of amazing organizations that have been using the standard and can really share, I think, some really relevant and interesting experiences about what has worked well and what perhaps needs to be changed on this. So I'd like to maybe start, if I can, by just asking you to give a quick introduction to yourself and your own personal reflection on how did you hear about the CHS and what it meant to do. So Aisha, can I start with you?
Sure. Thanks, Philip. So my introduction to quality and accountability standards date back to 2005 when earthquake struck Pakistan. And at that time, I remember that we started to learn and use Sphere, HAP, and then I was part of the journey that led to present day CHS. So if I refer to your slide, I am from the seedling stage till now.
Excellent. And for you?
Thank you, Philip. And first of all, I'm pleased to be here, to be part of this historic event. My personal relationship with the standard dates back from the days of HAP and People in Aid. TPO Uganda was a member of People in Aid. And due to the quest that we have in my organization for being accountable, but also doing quality work, we were members with People in Aid. And we naturally moved and transitioned into the CHS Alliance once the CHS standard evolved.
Sorry, I need to interrupt because we haven't introduced you properly. Because we
sorry.
had a slide and then the slide disappeared. But it's really important to introduce you. So Ayesha Hassan is, and that's where I need my slide, Associate Regional Director at Community World Service in Pakistan, with a very long experience working in development aid and humanitarian aid and with communities. And Rehema Kajungo, see, that's why I need this. Kajungo is Deputy Director at TPO from Uganda. Also very long-standing humanitarian and development worker, and both great experiences with the CHS. So thank you for being here. Thanks.
When I asked the question, how familiar are you with the CHS?
Yes.
Both of you are very, very familiar.
I was at this.
And you? What would you say?
Between 3 and 4.
So this is thank you for joining us, because I think it's really important when we already had a few questions in the chat about is this Geneva-based standard, and clearly both of you have been using this in your organizations and directly with the communities that you're working with. So I'm really pleased that you're joining us today, and again, we'll ask some more questions again on what that has meant for your organizations and how it's transformed the way your organizations have worked with communities. So Rahima, would you like to maybe give us a few reflections on what CHS meant to your organization and your relationship with communities?
Yeah, thank you, Philip. Being part of the CHS has turned around the organization, but most importantly, it all started when we signed up for the independent verification and we did the initial audit. Initially, we were working and following the standard. By the moment we signed up for the independent verification scheme for 4 years, and we did the initial audit, the findings were in some ways good, but on the other hand, they were a little bit shocking in a way, because we had been following the standards. We had lots of policies. We were working with the communities and we thought we were good to go. But the initial audit unearthed some gaps about the way we're relating with the people that we work with, about the policies that we had on shelf that were not being applicable, that were not being practiced, about not involving the people that we work with. There's involvement, but there's real involvement where you mean business. We go and pick a few information from them, but we would not involve them in the design of the projects, implementation, but also monitoring. So since we underwent the independent verification and got the results, I think our worst score was on commitment 5. And maybe in the revision, that is something that we need to look at. Why do we continuously score less in commitment 5? So we had a feedback and complaint mechanism, but we scored poor on it because it was there on the shelf. And when they asked people that we serve with, work with, they actually mentioned another organization. They knew their policy, but they didn't know ours. So then it was awakening for us. And we actually had to go back to design the complaints and feedback mechanism afresh. We involved them not only in developing the feedback mechanism, but also in telling us how they wanted us to do it. And we have empowered them to be able to call in and give feedback on how they want us to involve them. But also for the policies, internal policies for TPO Uganda, as I mentioned, we had policies, but some of them were being developed because a donor wants a policy. They're coming for due diligence and they're asking, do you have an environmental policy? Do you have a nature policy? To tick up the boxes. But once we underwent the initial audit, because when you're being audited, you do not only show the document. There are follow-on questions to verify that you're actually using the policies. So for us, now we had to unpack the policies and be able to put them into practice. But also there are some policies that we didn't have. And as I speak, CPO is being looked at as a reference organization. Some of the international organizations have actually come to us to benchmark on the policies. We have been in some consortia where the leading organizations, who are usually international organizations, have referred the different implementing partners to come and use our policies. So in that case, we are quite a bit ahead. And also in terms of the trust with the donors and the confidence, once we had the policies in place, once we had the systems working, once we're accountable with the people, then the trust from the donors, the confidence in what we're doing greatly improved. And that has led to getting more resources for organization, expanding the scope of work that we do in different places beyond what we're covering. That is meaning reaching more people in services, but also improving the quality. I can say that we have had an increase of about 40% in our annual budget for the last 1.5 years. So there are quite many achievements that we had as an organization, but I guess we don't have that much time.
So thank you for that. I mean, it's really interesting. It's not just the relationship with communities, it's also with other stakeholders and partners. And I was struck by that the communities, you said, if I understood correctly, knew of another organization's policies around feedback complaints, but they didn't know yours. And it's interesting that communities are also, when they are aware of what is available and what they can expect from organizations, they can actually ask them. Can I turn maybe to you, Aisha, and hear about your experience? You have done HAP and people in aid, so you're familiar with this, but what makes the CHS different the way that your organization has been working?
Thanks, Philip. So I would like to share how we are applying or using CHS at various levels in our organization. And I'll start with that, what quality and accountability standards has taught us most importantly is the continual improvement. To revisit, to reflect continuously, to make sure that what things with reference to 9 commitments are working well, what are the things which are not working well, how to make them work. So this is the key, I think. Then if I share few examples, our performance management system, it is derived from core competencies framework. So not only we have contextualized the framework so that we not only appraise program or project related teams, but also support functions like finance or operations. So this is how our appraisal system is based on competency framework. Then our monitoring system, in our monitoring system, we do refer to various commitments and we ensure that for example, if we are talking about community participation, community engagement, then if we are talking about other commitments, so all of these commitments are reflected well in our monitoring system so that we can get data on regular basis and see that how things are going as per and how our compliance is as per CHS and other quality and accountability standards which we are using. Then we have tried to put systems in place so that we do things systematically, as maybe previously before using these standards, still by default, we were doing certain things. But now CHS, through CHS, it is ensured and such systems and policies now are in place so that we don't miss any aspect of it. So for example, every program team in our organization, they do have a quality and accountability plan so that they don't forget any commitment when they are interacting with communities, when they are doing work with other stakeholders and implementation, etc. So this is how we and as a result of this, I think now we have more engagement with communities. We are a more inclusive organization, understanding and promoting diversity, pluralism, more coordination with stakeholders is happening. So that's what how CHS is adding value to our work.
That's really interesting because I think you've just described the 9 commitments as an integrated whole. So you're talking about in your finance, you're monitoring your management systems, your human resources or people management, alongside of all the other work that you do in the programmings with communities. So it's a really interesting example of how the standard with the 9 commitments seems to have been completely integrated into your organizational way of working and in a systematic way, which I think was one of the intentions behind the CHS when it was created.
Yeah, and so I was wondering whether you can share an example of how concretely your relationship with the communities you work with has changed through working with the CHS. Rehema?
Yeah, thank you, Alinia. As I earlier alluded to, our relationship with the community, but also the people that we work with, has greatly improved as a result of working with the standard, but also undergoing the independent verification. Because as I mentioned, we're now more accountable. We are involving them in the work that we do, consulting them meaningfully, not only going and designing a project and coming back and saying, you know, here we are, we're implementing. So for every project that we are designing, we're starting with the community. We're going on the ground and consulting them. Because, you know, organizations, NGOs, you're in a dilemma because you're handed down a scope of work from the donor, and they tell you they want you to develop a proposal. They even give you the locations. But we have been able to go past that, and it's possible to go back to the donor and negotiate. So with the verification, independent verification that we went through, we're able to really appreciate the involvement of the community right from the start of the project. So we're involving them, consulting them at the design stage of the projects, asking them what are the issues that they want us to include in the next phase of the projects. What are the gaps that our interventions, you know, are having, so that we can take care of them in the subsequent proposals. And many times we've gone back to the donor and requested to amend the scope of work to be able to take care of the real needs of the community. But also in terms of accountability, before that, our staff, and this is really common where you have a wide scope of work and you have staff, you have the head office is based about 400 kilometers away. 400 kilometers in Europe is easy because you can do that within probably 1 hour on a train. But for us, you need 8 hours to travel. So you have a project that is 8 hours away. And the only monitoring on a daily basis that you can do is maybe make a phone call, or so sometimes staff are not as responsive. They are not as dedicated as you want them to be. But now with complaints and feedback mechanism, where our staff know that, you know what, they're going to go in, there's a contact where if their services are not being appreciated, or if they make people wait for a long time, because sometimes social workers, you have a number of activities and targets. So you book one group now, you assume that you'll finish it early and go to the next one, and then you delay. So sometimes they make people wait for a long time. But now with the feedback mechanism, because they know everything that I do, I not only have to be accountable, but they're going to, they have where to report to. And that has really increased how our staff treating and being accountable to the communities. But also in terms of trust and confidence from the staff, from the communities. It's very interesting to see when the communities are empowered, the people that you work with, from the timid recipients of your services, but to being empowered and working alongside with you as, you know, implementing partner, if I may use that word. So we use what we call community support structures that are largely composed of the people within the community, and they implement alongside our paid staff because they know the area so well, better than our staff. And as a result of this trust and confidence, I'll give you an example. When we all locked down for COVID-19, our services, which is mental health and psychosocial support largely, weren't considered as a critical essential service by our government. They said, you know, for you can go home. So we're all locked up. But most of, and I think all of our community offices remained open because the communities went to the government officers that were issuing out travel permits and insisted that we must get travel permits so that we can continue operating. And none of our field offices closed. We got the travel permit from the local authorities so that our services continued moving. And they insisted, they said, this is a critical service to them. But that came as a result of the trust and the confidence that they had in us. And many organizations actually closed. Whereas for us at head office in Kampala, we actually closed for a long time. We got travel permits towards the end of the lockdown. But our field offices remained open because the trust that we have gained from the communities, the accountability that we show, they're looking at us as one of their very own. So there's a lot of improvement, but also in terms of the quality of services that we deliver into the communities, greatly improved. We're following the standards, we're following the different commitments, we're being accountable. I think everyone is happy.
How about you? Well, in our case, I'll say that like the most value addition where we see of quality and accountability standards is like our approach of working. Like, for example, I think as a result of our work with these standards with CHS, like we have started to invest more in building, in empowering community structures. And that has not only like brought like more ownership from the communities, but like sustainability to our work as well. Like, for example, if we are doing a program, and in that, if we have empowered one structure and facilitated them so that they can, let's say, do a health camp. So like doing once a health camp for their communities, it has given them the confidence. They have learned the way that how they can now do it in future, because these community structures are the ones who will be staying there. Like these are, and here I'm talking about like very small grassroots level community structures. So this is one thing which I think has added value, a lot of value in our work. And then as like Rahima is also saying, trust is another aspect, I think, which we have gained by application of CHS. And there are like, as a result of this work, now there are proper mechanisms in place to get like feedback from communities, to have like complaint response mechanism in place, like whole closing the loop kind of mechanism is in place, that we are getting feedback, we are addressing it, we are getting back to communities to share with them that like how we have incorporated their suggestions, their feedback in our programs. So that has like really built, I think, a level of trust with communities, with our organization. So I think that is another value addition which I see. Yeah, thank you very much.
Yeah, that's really interesting too, because we're all having this debate now about kind of localization and participation. And I think both of your organizations have demonstrated that already. The elements of the core humanitarian standards help your organizations build and strengthen that relationship with communities and really demonstrate localization and participation and engagement in your ways of working without having maybe too much discussion and debate about it. It actually, you're reflecting that in your way of working. Interesting. Well, we're here today to talk about updating the core humanitarian standard. And it's clear that both of your organizations have found it a useful tool, but I'm sure that your experience going through a verification audit or training your staff and upgrading your systems to reflect the CHS have probably shown you a few areas where you think there could be some improvements or things that need clarification. I'm wondering if you might share some experience with us today around your reflections on what you think has worked well, and more importantly, what are some of the things that you would like to see discussed and perhaps resolved in terms of improving the standard in the revision? Aisha, maybe I'll start with you on that.
Sure. Philip, I think what we miss, and here, like I am talking both from the perspective, because like at one level we are applying these standards within our organization. And then like we also work with other organizations working in Pakistan, in Afghanistan, in the region, to build their capacity on CHS, on other quality and accountability standards. So I'll be talking from perspective of both. So what we miss when we talk about CHS is that like this standard is too humanitarian, all language terminology used in it, it's all humanitarian. Whereas like, for example, if I talk about my organization also, we do both humanitarian and development work. So it is not that like nothing is stopping us, that no, there is a line, and if it's humanitarian work, we are talking about community participation, and in development work, we can't. This is not like this. But when we talk about, and if we think about like very small organization, an organization of having like 6 to 10 members, located somewhere in like a very remote southern part of Pakistan. So I think it will be much easier for them if they have one standard which they can use both for humanitarian programs and at the same time for development projects too. So this is one thing. And then I feel that like CHS often puts a lot of emphasis on referrals, on coordination. But here, if I specifically talk about referrals a bit more, like say in our context, referral system doesn't work. And at times it gets very difficult for us to explain to donors also, because for example, for child protection, for GBV cases, as such, there is no referral system present in countries like us. So I think if like CHS, and it's very good that like it is going into revision process. So if this aspect can also be looked into, to see that like what the ground realities are, what the challenges and issues are, and then suggest that like what can be done so that organizations can easily comply with it. Similarly, if we talk about coordination, like of course to a certain extent coordination is possible and should be done. But when we talk about advocacy for an organization, for very local organization, it is another project for themselves. So it's not that easy that like coordination mechanism exists and an organization working in area A goes to all stakeholders and they get the required information very easily. It doesn't work this way. So this is another aspect which I feel if in revision process, it can be looked into, it will be good.
I'm sure that we can find a lot more, but there's a good examples about a global standard being grounded in local realities and making sure that that's accessible.
Yeah. If there is time, I would like to share like one more point. I feel that like from our experience, I think if this thing can also be looked into revision. See, here we are talking about, like I was saying, very small organizations, very small local organizations. And of course, like translation is one thing, facilitating them to understand standard is also something. But I also feel that like, see, if we are, for example, doing training for some local organization,
Apologies for the interruption, but the microphone is cut.
Yes, I see that here.
Is that okay now?
Can you hear us, on those of you online?
Yes, we can hear you now.
Thank you.
So I was just saying that at that, the barrier comes in. And then I think the application process really goes, it slows down. So I think the local organizations, they may need some more hand-holding, some more coaching and mentoring. So maybe if CHS can think about having some structures in place which can facilitate this process. I think there should be some connecting body between CHS and local organizations who can and that body, I am talking about such a body who can understand local context. So this is another suggestion.
So interesting points there. And obviously we'll want to explore those along with all the other feedback that we get on what the updated standard might include and how it could become more accessible and user-friendly to more stakeholders. What about your case? You did mention commitment 5 already. What are some of the things that you think work well and others that you think might need some improvement?
Okay, thank you, Philip. And first of all, before I talk about what needs to be revised, I think I want to appreciate CHS Alliance for the commendable job that you have done in terms of translating the standard in several languages so that it is accessible to more people, but also the CHS in plain language. I think that was in a bid to try and simplify it and make it easy for the people that are using it, but also the capacity building and the availability of a support network that is there where you can learn from them, but also get support when you need it. Ayesha mentioned some of the things that I wanted to talk about, including being too humanitarian and also coordination, because even when we are doing the audits, there's that form where they ask you humanitarian, and actually our first experience was, but most of our projects actually were in the development context. So I think she already mentioned about it. That these might not necessarily be on the standards, but the entire framework. I think we need to popularize the standard once it is revised, and even the current one. What are the benefits that members would get once they apply the standard? I think there's a lot of effort that has gone into it, but I think more needs to be done. As a local organization, I need to know, I'm going to commit to this, I'm going to be contributing a small annual, because now the fees have been revised. We want to appreciate the people that advocated for that. But I think the benefits for being members and being able to apply a standard need to be very clearly defined and presented to the members. And then later on, even the verification scheme needs to be reclarified. And if you're going in for self-assessment, what does it entail? If you're going in for independent verification, what do you need to know? How about certification? My own experience was that we actually applied for independent verification, I think without knowing what it entailed. And now we look back and thought probably if we knew what it entailed, probably wouldn't have gone for it. But we are very happy that we went for it. But then once we applied, we were like, oh, what is this for us? It was very tough. But then I'm looking at probably other small organizations faced with that volume of work and expectations and demand. I think they might not go through. So I think we need to do some bit of work to try and simplify but also clarify all the schemes. Then relatedly, continuous clarification on the standard, but also the verification. When you run through the commitments, great job was done, but I think there are some commitments that could do with a little bit of merging. Some of them have cross-cutting themes. I think like commitment 3 and 6, when you look at them, I think they can be merged. I would also want to see, the standard being enriched with some current and critical issues. In your presentation, we had climate change, we had COVID-19. I think there are some aspects that are not covered. We specialize in mental health and psychosocial support, and with COVID and the wars that are in Ukraine and everywhere, I think we cannot take a blind eye on the effects of all these on our mental health and also psychosocial well-being. I would want to see in the revised standard that included in, and it's not only in the work, but also around the staffing, around the communities that we work with, because it's really a big concern. We have lots of suicide, cases, and the mental health issues are, rising through the roof. Like we did for SEA, because I think that was a concern, but now it is highly integrated in almost all the commitments. So for me, my wish would be identify some of those areas and try to. Then there's an issue of cultural difference. Aisha talked about it, but I think it is an issue that we need to carefully look at, because we're talking about having a global standard, but also mindful of that global standard not being applicable to some cultures. We had an example of when we did our initial audit, the auditor, we went into a household, and the woman who was supposed to be interviewed, there was a young child who came, and the mother shoved her away. Go. And so the husband came and also was pushing the child out. In an African culture where adults are seated and deliberating important things, children, that is not a place for the children. So this auditor packed up his bags and said, no, I can't be in this place. There's violence in this home. And we terminated a very important engagement that you had booked over time, and we actually missed it out. And I tried explaining to him, I said, you know what, that is not violence. Actually, they were not rude. They were trying to put the child where he belongs. But you see, something like that, a very small, and what else is there that we can talk about? I think the cultural differences, but also having a mix of the auditors, if you can have a global international auditor paired up with an auditor that is closer to the cultural inclination of that place. For example, if you're auditing Aisha, can you have you and maybe have someone that knows the Pakistan culture so that they can appreciate what is. And then finally, finally, to be patient with the local organizations. I want to believe that I have a sense, and I've been working with some of you to try and encourage local organizations to be part, but you tend to feel people are beginning to get tired and saying, but these local organizations are not coming on board. These local organizations are not coming on board. I think we need to be more patient because local organizations are at different levels, and you get to appreciate them when you really go onto the ground. Some of them are really small. Some of them, they can't even understand clearly what it is. So if we can give this localization and trying to encourage local organizations and give ourselves 10 years, 15 years without losing patience. And I think I would finally appeal to the donors, whoever is talking to the donors. I think this is a noble cause that we need to fund so that they don't give up on funding that localization, to try to encourage as many local organizations to come on board. Because I think local organizations are actually, they have a lot to gain from signing up for the standard. Yeah, I think I'll stop at that. Thank you.
I mean, these are fantastic inputs, and I'm sure we're going to get lots of similar reflections from organizations that currently use the standard, ones that are not. You mentioned, both of you, to a certain extent, verification. Just want to clarify that the revision will look at the content of the standard. I think it's inevitable we'll get questions about how organizations apply it and monitor and use different forms of verification to show that, to demonstrate that. But the revision itself is going to look at, is the content that we have now user-friendly? Is it accessible? Are there issues, as you've mentioned, like potentially psychosocial support and mental health, and making it more culturally contextualized and local to the local things? Those are really important issues to keep in mind as we work through that.
Thank you. I would like to link what we just heard from you to some of the questions and comments we heard from the chat before handing over to you in the room. I think the whole element of cultural difference and of what does a global standard mean at local level has come through quite strongly in the chat. The question is, well, what interest does a local organization have to work with the CHS? Clearly, that is something that we need to unpack and understand. And a discussion with a local organization that doesn't know the CHS will be very different from a discussion with an organization that has already worked with it, and different questions will be asked. Same with the community. What does a community have to have? What kind of interest does a community have to in the CHS? That might not be the question to ask a community, but the question will be, how is your experience working with the organizations that work with you, and how could that be improved, and what are your comments around that? And that brings me to a question whether there will be standard formats for consultation events. Yes, there are, going from focus group discussion questions, suggestions of those questions, to organizational discussions, to regional workshops, and so forth. So there will be guidance and a format to report back to us, because that way we can actually use and integrate the feedback we receive. There was one comment about the biggest challenge that we have, and I've mentioned it briefly, is to turn the process around from a top-down event to something that is grounded in local experiences and bottom-up. The sentence that was written is nothing about us without us. I think we all agree. We hear it. It's an important comment to not only make, but for us to keep reminding ourselves of, to make sure that we really work with local organizations, local actors, and for local organizations, actors, and communities in this revision. There was one question briefly. Is there an impact? What did we learn from the last 7 years about the CHS? Its impact. There has been a lot of learning, in particular through the CHS Alliance with their yearly HAR reports. There's a lot that we understand from how an organization picks up the CHS and works with it in this rather structured way, where the impact is maybe less clearly written out, is how has the CHS impacted in other ways. And one important aspect is that it is part of the Sphere handbook. It has replaced the Sphere core standards at the time, and it is a foundation chapter for other technical standards as they are grouped in the humanitarian standards partnership. So that also brings the CHS into a realm of linking it with technical standards, which is an important element to keep in mind also during the revision process. I will stop there with the online. Oh, okay. I'll now report. Okay, there will be more from online, but I will come back to you later with that.
So maybe we can have open the floor for any questions or comments. We have about 10 to 15 minutes left scheduled. So let's maybe have a quick round of maybe reflections or observations from what you've heard. If you have questions for Aisha or Rahima as well, that would be great. And then we'll finish the session today with asking you, we have 9 commitments. We'll ask you to provide 9 inputs to us today before you leave. So anyone like to make any comments or reflections from the participants here in the floor? Balwan, please, and then Charlotte.
I wasn't sure whether you wanted any input from one of the 3 gardeners, but we are going to try to provide our inputs, to nurture the forest. I think I want to echo one of the points that Ananya made, is that the CHS is an integral part of SPHERE, and it's also a foundation for other humanitarian standards, which are both a part of the Humanitarian Standards Partnership, but also emerging standards as well. And that's important. But I also want to echo a point that it's not just about organizations. It's actually the biggest and most important stakeholder are people affected by crisis. And actually everyone has been affected by a crisis, and COVID-19 was a good example of that. And I think the way the consultation process is structured will require all organizations to make sure that individuals who are affected, communities are involved in the consultations. And if you have ideas about how the consultation should be structured, please share that with Ananya and Philip as well, because we can only make suggestions, but each of you will know, as we've heard from Aisha and Rahima, the examples of how communities work differently. And those kinds of differences should be captured in the way the consultations are carried out as well. But I think this is both a personal perspective, but also from the SPHERE perspective, is that the CHS should be there shouldn't be a CHS and a CHS in plain language. There should be just a CHS, which is in plain language from the outset. Because if it's relevant and understood by organizations, but still has a lot of jargon and terminology which is not understood by communities, then that's exclusionary. And if it's exclusionary, communities are never going to be able to hold organizations to account for the services they provide. So I think that has to be the lens that we use in terms of how the consultations are held and carried forward. And I think the 3 gardeners, if I may speak on behalf of the 3 gardeners, that we will make a promise that we will listen to feedback that comes, and the steering committee will hold the management group to account as well. And if there are things which cannot be agreed upon, we will have to go back to communities to say, tell us what is actually going to make sense. It doesn't make sense to rush through something and say, this actually makes sense for organizations. We want to make sure it makes sense for communities. And that's the way to also hold organizations, but also donors to account, because it links. Many donors, as I think we heard from both the examples, that donors impose things on organizations, and then organizations end up having to impose and then negotiate. It should start when the community says, this is what makes sense for us, and this is what we should do. But I think the overall message from me is that the CHS must be relevant for people who are affected by crisis, communities, and organizations alike. And that's where I think the simplicity of language is very important. The important thing that can be done once the CHS is updated is also that we end up with 100 translations of it in the languages that are required. Because that's the only way to make sure communities can use it as well. And that will require inputs from all of the people who are present in this room, those who are online, and those who are not here as well, but believe that this is very important. So I'll stop as a gardener.
Charlotte, please.
Thank you. So I'm Charlotte Dufour. I'm a board member of Group URD, and Véronique de Geoffroy, Executive Director, apologizes for not being there. But I just wanted to appreciate what Rahima and Aisha have said, which really echo some of the priorities Group URD sees for the revision, more focus on the environment, the impact of climate change, the nexus, and very important, making sure the tool is adaptable and accessible to local actors of all shapes and sizes and forms and institutional structures. But if I can add a personal reflection, I was working with Group URD 20 years ago on one of the seeds that led to the CHS, which is the quality compass. And a lot of the structure of the CHS was born from that. And this compass rose. And I wanted to share what was animating us at that time, because it's striking the relevance today. This question, how can you have a global reference that is adaptable to such diverse contexts? And thank you for bringing that. We feel it's still very relevant. You know, sometimes we need a screw, but we have nails, right? So that was a big challenge. And the value of process versus procedures. Right? Sometimes we maybe have too many procedures, but I liked, Aisha, how you said the value of the learning process and how can we bring that to the fore as well. And again, really the putting the populations at the heart, that is something that warms my heart to hear your testimonials 20 years later. I think, great, there's been progress, but I'm also very concerned that there's not enough progress at all globally on the whole so-called participation revolution, which right now feels like it's just turning on itself rather than really changing the practice. And I think that's something we can really push through this reform, this revision. So thank you.
Thank you.
So if I may add to that, thank you very much, Vanda from Plan International. I think the whole echoing what Aisha and Rema already mentioned, also from Baldwin and Umam. One thing that also I reflect that, about the language, about become very humanitarian, and we forget about the development. And in practical, when we are using, I'm coming from Asia Pacific, we are already using it in our response that, it's reaching to our local partners, even reaching to young people. We consult with young people, even we do real-time review for our emergency response. Let's say Typhoon Famco in Vietnam, Typhoon Ray in the Philippines, we do our real-time review where we are referring to the core humanitarian standard. We consult with young people, young organization, women organization that working with us. They start to get, the value of this. But we also forget how to kind of like reaching out to the government, because when our consultant who do the real-time review go to the government authority who are dealing with the disaster management and mention core humanitarian standard, they are still, what is it? But when we try to go, it's the commitment about how to make humanitarian appropriate, something like that, then they are, okay, got it. But if it is, CHS, they are still kind of like confused. So maybe with the revision process to take it into the consideration for that. And I think more widening the consultation, and I like all the process that Aninia already mentioned. Plan International is committed to kind of like support the revision process in all of the region where we are working in 4 region. But also that's why the question, I mean, if we would like to kind of like do the revision, the consultation at the regional level, maybe like Plan is going to do that, but we also engage at the regional level. Is it the Philip and Aninia will also control and communicate with us? Oh, okay, there are a number of regional network that keen to do so, so we maybe can coordinate, because otherwise there are so many regional consultation, and it might be also take time to do that. So yeah, a reflection and a question. Thank you very much.
Thank you for the question and for the reflection, and the answer to the question is yes. That would be our key contribution that we will make, is to make sure that the process is as coordinated as possible.
Okay.
It's also opportunities to share and learn that, as we've heard today, there's so many great experiences. So we want to make sure that as many of those different stakeholders can be involved.
Okay.
More questions, comments? At the back there, yes.
Sure. I wanted to applaud everything that you said. I'm Ellie Kemp with Clear Global, and it's wonderful to have the issue of language and the accessibility of the standard be brought to the fore. I think it's going to be a challenge for your consultation process, clearly, and where we can be helpful in thinking some of that through, we would be delighted to do so. But I think what we've learned, certainly in the period since the CHS was first developed, includes how fundamental language is as a factor of exclusion, organizational and within communities, and certainly between the huge and hairy international humanitarian system and individuals in need of assistance and protection. So it will be exciting for us to see what comes through. And we very much applaud the efforts that you're making to make this a genuinely consultative, to listen to the communities that we're trying to be accountable to. And also to flag, we're members of a number of networks. I was just at the H2H AGM. I think that group is very interested to be part of, to facilitate, to bring its members into this consultation where that can be helpful, or where they can help reach out to their own partner organizations to expand that as well, and perhaps others like CEDAC, like ICFA, etc. might be able to do something similar. Thanks.
Great, thank you, Ali. Anyone else? At the back.
Hi, I'm Marina, and I work for CFAN. We're one of the first adopters of the CHS. We were one of the first organizations to be audited, so definitely have seen the value of it, and helps us keep ourselves to a high standard. It was the first audit was really an eye opener. We really thought we had it all covered, and the first corrective action requirements were a surprise. But yeah, it was really good to have it. One thing we have, or struggled is probably an exaggeration, but observed over the last years is that in the areas where we are weaker, we could really use resources, training tools, something that would allow us to train our staff, but also to train our partners, because we work from our partners primarily. And I'm wondering if that's going to be a part of the consultation as well, if there's anything like that on the cards, that the follow-up version of the CHS would also come with tools and resources, like to echo what Aisha said about, having those sample policies, tools to help our local partners embrace the commitments in practical terms. But also, will there be tools to facilitate such discussions about the new version with our partners or with communities, or is it completely up to us how to structure those conversations? Thank you.
We definitely want to provide as much orientation and guidance to any of you who can leverage your networks, and particularly the communities that you work with, so that we are able to consolidate all that feedback and then help to interpret that to see what it is that needs to be changed and what needs to be reinforced. And again, it's an updated standard. Through the process, we'll, I'm sure, hear of other issues that maybe are beyond the scope of the consultations, but we will certainly be able to flag those ones that will require more discussions beyond perhaps the scope of the revision itself. And again, the whole part of the process of making it as participatory and inclusive as possible is that we also have more dialogue about what is working well, raising awareness for those who don't know the standard, and learning about how we can, to go back to that point, maximize the impact when it comes back to quality and accountability.
Sorry, just to add one thing, also speaking about our partners, the language, we found it very difficult to translate the very humanitarian language of the CHS into the development language, because many of our partners are dual mandate organizations. So it's something like that planned to be addressed.
We have some offers of support already. That's great. Tanya, maybe you'd like to take a moment?
Yeah, no, thank you. Thanks so much for the session. Just maybe a couple of words just to say how important this revision process is going to be. I think we've got a really difficult balance between, I think as Balwin put it very strongly, this need, we've got to keep it simple. At the very base of the CHS, we've made a set of commitments to affected people. They need to be able to understand those commitments, and they need to be able to hold us to account. That's, I think, the essence of all of the copyright holders, the commitment you have to make this as accessible and simple as possible. And at the same time, where we're calling on everybody's support for this, is we're tackling something that is incredibly complex. We're dealing about accountability in a system that has entrenched power imbalances that we're trying to change with this standard. And that is complicated. And what we have to try and balance through this process is getting that language right, but not losing the power that this standard needs to have to be able to challenge people on accountability. As you put it, Philip, at the beginning, I think if we take away from this, it's about people's rights and organizations' responsibility to uphold and meet those rights. And we cannot lose that accountability that we all need to hear. We heard it from Rahema, we heard it from CWSA, the absolute criticalness of being held to account. We all agree with that, but none of us yet want to be held accountable by anybody. So I think that's going to be, I think from the CHS copyright holders, that's the commitment that you have from us in this process. We'll try and keep it accessible, and yet we also want a robust discussion on the accountability and power challenges that we're dealing with this standard.
Thank you. We'll run to the kind of official end of this, but before people go, I'm going to hand out, if you can take one of these and just take a look at these questions here. We have 9 commitments within the CHS. So we'll get 9 inputs for you if you can. 3 things you think work well, 3 things you don't need to be changed, and 3 things you can do to help support the process. In the meantime, we do also want to share our contact information with you and remind you that the existing website is going to be constantly updated with new information and some of the guidance and tools to help you facilitate that consultation. So just take a few moments, and if you could just stick them up on the walls or any of these charts before you go and make a final reflection. And
if the color is meant something, then
no, the color is fine. You can use the colors and you can write, and if you'd like to keep in touch with us, maybe jot down your contact details on that as well.
And before everybody leaves, a huge thanks to Rahema and to Ayesha. Huge thanks to you for having been here, taking a minute to think about these questions.
And also thanks, of course, to all of you online. We weren't able to capture all of the things there, but we're going to save the chat. And all the questions that were raised in the chat will obviously include that into our thinking about the process. And of course, to the teams of CHS Alliance Sphere and Grupo RD who have been supporting Anini and I as facilitators of this, but we really couldn't do this without each of them, and members of our steering committee who are also here. Thank you all for joining us today.
Thank you.